welcome to the third module of the Health Diplomacy series. My name is Mary Sacco. I am the Chair of Global Advocacy for the International Bureau for Epilepsy. It is my distinct honor to be able to walk you through this e-learning module, which was developed to help you to better understand how to leverage the United Nations Sustainable Development Goals, or SDGs, for action on epilepsy. The learning outcomes for this module are to understand the importance of global health commitments, specifically Sustainable Development Goals and universal health coverage. And it is also to leverage these SDGs to support IGAP implementation. The 2030 Agenda for Sustainable Development, SDGs, was adopted by all UN member countries in September of 2015. UN member states unanimously agreed on a set of 17 interdependent goals that would apply to the entire world community. These member states recognize that in an interconnected world, infectious diseases can spread across continents in a matter of days. The lifestyle factor spread by media and advertising can influence global populations within months, and knowledge can be shared instantly, making these global goals meaningful universally. The UN members recognize that economic prosperity, climate action, poverty reduction, and world security required universal commitments to these 17 global goals. The SDG negotiation process was a political breakthrough that has led to multilateral diplomacy. Health has proven to be an integral component and outcome of every SDG that was negotiated. The SDGs reinforce that partnerships need to drive implementation at all levels of governance. The SDGs are grounded in a whole of government and whole of society approach. The IGAP includes global goals that can be implemented using the SDGs. For example, SDG 1 relates to poverty, the loss of income leading to vulnerable sections of society and families living below the poverty line. People with epilepsy too often live in poverty, and we can look at the root causes, which include human rights violations, lifelong driving bans, lack of access to health care and essential medicines, stigma and discrimination in marriage, schooling, and employment. Another example of how the SDGs can align with the IGAP implementation relates to SDG 2, which is food security and sustainable agriculture. Working with the agricultural sector, we can promote the need for better pig pen management to reduce epilepsy caused by neurocysticosis. Organizations like the UN Food and Agricultural Organization lead efforts to provide technical knowledge and information to aid food and agriculture in developing countries. These organizations are ideal partners for chapters working for epilepsy prevention in developing countries. SDG 3 relates to good health and well-being. This is the SDG that addresses access to services and trained health workforce, access to essential medicines, reduction of out-of-pocket health costs, and implementation of universal health coverage, or UHC. When the IGAP was discussed and endorsed in May 2022, it was listed under the agenda items related to universal health coverage. This strategy priority is to provide access to care to 1 billion more people in the next 10 years. By endorsing the IGAP, member states acknowledge that people with epilepsy have the right to health care, have the right to safe and affordable medicines, the right to be educated, the right to paid work, and the right to fully participate without discrimination in their communities. Universal health coverage, or UHC, is the vision that everyone, everywhere, can access the health services they need without facing financial hardship. It includes the full range of essential health services spanning health promotion, prevention, and treatment. It is included in the United Nations Sustainable Development Goals as Target 3.8 with two indicators, 3.8.1 for service coverage and 3.8.2 for financial protection. IGAP Global Target 2.1 is that 75% of countries will have included neurological disorders in the UHC benefits package by 2031. Epilepsy could be a big win for policymakers because when they put programs in place to help people with epilepsy, they can achieve UHC. This is because epilepsy is treatable. More than 70% of people with epilepsy could live seizure-free lives if they had access to appropriate anti-seizure treatment. Epilepsy is also preventable. 25% of the global burden of epilepsy cases can be prevented. Treating epilepsy will reduce mortality. And epilepsy care is cost-effective. It can be diagnosed and treated in a primary care setting. The UHC partnership works with governments to strengthen national health systems so that everyone, everywhere, can get the health care they need without facing financial hardship. The UHC partnership is recognized as one of the most flexible funding streams in WHO. On this slide, you'll see some of the donor countries that provide funding to help other countries to implement UHC. SDG 4 ensures equitable and quality education for all. Having children with epilepsy succeed in school is a priority of all IBE chapters. They could be partnering with other UN agencies like UNICEF, which shares this priority and has offices in 190 countries. UNICEF's mission is to help children and youth to fulfill their potential. Other non-state actors, for example, the International Federation of Teachers Associations, and even corporations like Microsoft, are committed to SDG 4 to ensure equitable and quality education for all. SDG 5 is to achieve gender equity and empower all women and girls. UN Women focus exclusively on gender equality and women's empowerment. They have offices in many countries in every region. Achieving gender equity and empowerment of women and girls is a priority for IBE chapters as well. An IBE priority is to change punitive legislation that impacts the ability of people with epilepsy to maintain employment. It is also to add protective legislation and standards to give people with epilepsy paid work. SDG 8 relates to decent work and economic growth. UN agencies like the International Labour Organization share this priority. Their mission is to promote international labor rights and employment standards to give people paid work. This health diplomacy module was developed to help the epilepsy community to understand the importance of global health commitments like the Sustainable Development Goals and universal health coverage. It was also developed to help IBE chapters to leverage the SDGs to support IGAP implementation. The key takeaways from this module are that implementation of the SDGs will help people with epilepsy, that there are many global partners that also work to improve outcomes that are important to people with epilepsy, that the social determinants of health are embedded in each of the SDGs, and that UHC, or universal health coverage, is the vision that everyone, everywhere, can access the health services they need without facing financial hardship. UHC is part of SDG 3, which is good health and well-being for all. And WHO is committed to 1 billion more people benefiting from UHC. The IGAP Global Target 2.1 is that 75% of countries will have included neurological disorders in the UHC benefits package by 2031.